to meet you, Alan Dick.
I feel I'm gonna work.
Okay, well, welcome.
That's a great idea.
It is not.
Hey, you work for Papa John's and pay $11? Your next pizza.
So my case is on Barbara Baxter. It's her patient. Her two daughters. So I'll let you guys bask in that glory. All right. So she's a 49-year-old African American woman brought in by her family for confusion and inability to speak. In the ED, she had a laboratory workup notable for renal failure of unclear etiology that would require inpatient evaluation for treatment. So that's what we're in to figure out. So apparently we're supposed to just like forget that top half and then proceed.
Now, this is the first simple case I've led, so forgive me. And I know you're all prepared, so run with what you're going to do. But I may interrupt at transition points and pull a little more discussion out of the group if need be. But I'm going to let you try to run with this if that's okay. And I've looked through the stuff, and
Sure.
I think I have some other things to add if you want. So.
Sure. 2, the institution of renal replacement therapy is in stage 3 disease, no matter what the level of creatinine. 3, stage creatinine should occur within 48 hours. With increasing stages of renal injury, there is a concomitant worsening in survival. It has recently been recognized that the duration of renal injury, independent of the stage, also affects outcomes. Transient changes in creatinine are better tolerated than more prolonged changes. I also have this in a handout, so if like you're struggling to like keep up with this.
I think that's a good idea to pass out because this always bothers me how something as common as acute renal failure can be so complicated in the criteria. But a couple of points too, you may or not be making these, but the previous slide they mentioned they separated creatinine clearance and serum creatinine. Why did they separate those? They said a change in serum or a change in creatinine clearance manifested by the creatinine. Why did they separate those two? Aren't they the same?
I'm going to say no because of your question.
Well,
your creatinine kind of is based upon some of the physical characteristics. So how big is a person? How small are they?
that's part of it. So a lot of physiologic things go into the creatinine, but also it's kind of a late biomarker. And we're going by 48 hours here too. So if you think about if we were using that criteria to diagnose NMI, man, we'd be behind the 8 ball, wouldn't we? So it's kind of a late physiologic marker, kind of a indicator of creatinine clearance. So understand too that they had this time frame of 48 hours because it takes a while to get that creatinine up there. Okay. And they're not the creatinine clearance and creatinine are not the same thing. That's the point. Is it takes a little while to accumulate that.